Statutory compliances for NABH. NABH stands for the National Accreditation Board for Hospitals and Healthcare Providers, which is an accreditation body that sets standards for quality healthcare services in India. In order to obtain NABH accreditation, healthcare providers must comply with a number of statutory and regulatory requirements. Here are some of the key statutory compliances that healthcare providers must adhere to in order to obtain and maintain NABH accreditation. Registration and licensing. Healthcare providers must be registered and licensed by the appropriate state or central government authority. This includes registration under the Clinical Establishments Act, 2010, and compliance with local fire safety and building codes. Biomedical waste management. Healthcare providers must comply with the Biomedical Waste Management Rules, 2016, which sets standards for the collection, segregation, transport, and disposal of biomedical waste. Clinical trial regulations. Healthcare providers that conduct clinical trials must comply with the regulations set forth by the Central Drugs Standard Control Organization, CDSCO, and the Indian Council of Medical Research, ICMR. Patient data protection. Healthcare providers must comply with the requirements of the Personal Data Protection Bill, 2019, which sets standards for the collection, use, and storage of patient data. Drug and device regulations. Healthcare providers must comply with the regulations set forth by the CDSCO and other regulatory bodies regarding the use and storage of drugs and medical devices. Labor laws. Healthcare providers must comply with labor laws, including the Employees Provident Fund Act, the Employees State Insurance Act, and the Minimum Wages Act. Consumer protection laws. Healthcare providers must comply with consumer protection laws, including the Consumer Protection Act, which sets standards for the quality of goods and services provided to consumers. Compliance with these statutory requirements is essential for healthcare providers seeking NABH accreditation, as it ensures that patients receive safe, high-quality healthcare services. Healthcare providers must also comply with the NABH accreditation standards, which set additional requirements for quality healthcare service delivery.